Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe, chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle live in studio. Back to see you again. You know what? I tried to bring the good weather with me, but it's still cold out here. I mean, I guess I missed it by 24 hours. It was 3 degrees where I was, and I got to visit the fish and swim underwater and say hello to, you know, all the dolphins and the sharks and all that stuff. But anyway, I'm back, and I'm back home. I love to be here. This is like the best place in the world. 888-630-9625. Give me a call. Love to talk to you on any subject that you have in mind. Perhaps you've had a problem, you've tried, you've applied. Here's an opportunity for you to put the fire out and see what really works without drugs, without surgery. That's why we do this program. That's why we try to motivate you to be the captain of your own ship. And what better time than today in the light of national health care insurance and, you know, the Affordable Care Act and all that nonsense that's on our plate and kind of getting more ingrained as the days go by. The bottom line is simply this. You have to take control. You have to educate yourself. You have to make the decisions because there's nobody else that's going to do it for you. And if you set that aside thinking it's different than that, then think again, my friends, because it's really is the truth. I mean, that's what we see every day in our practice. And there's so many things that you can do. There's so many things that can make a difference cost-wise over a period of time, that when you don't have to take the medications, when you don't have to go through the surgeries. And there's so much data out there now that's saying that, you know, once you do one thing, then you're going to do something else, then you're going to do something else, and you end up in real trouble. Want to invite you this afternoon, the 23rd of March, Sunday, today at 2 p.m. I'm going to be at the Bow Tie Center, and we are going to be there in Reston Town Center in Reston, Virginia. Why? Because we're going to be showing the Ageless Health movie event. It's the Ageless Health PBS special. It's an Emmy award-nominated documentary and is based on what really happens in holistic integrative care. And it features 6 patients who were very sick, very unable to really continue their lives in many cases. There's a young woman who had MS, very advanced MS, 25 different lesions between her brain and upper spinal cord, in the process of breaking the myelin sheath, the wrapper around the nerve roots was progressive. There was a little boy who suffered severely from ADHD, and there was a older man who had migraine headaches that were due to TIAs, transient ischemic attacks, so they're called mini strokes in some cases, and so forth, and a young girl who had such severe allergic reactions that she would go into anaphylaxis and seizure patterns and have to go to the hospital her senior year in high school almost daily because of the things she was being involved in. Anyway, all 6 of these people, all 6 of these patients were turned around completely, 100% off of all of their medications. I fail to use the word cure because I just uncomfortable with that, but total resolution of their symptom processes without any medications. And to this day, years later, they're doing extraordinarily well. No recidivistic activity in any of these people. If you'd like to see how that happens, I'm going to be there to introduce the film, and I will stay afterwards to answer any and all of your questions. I think that you're going to find this very impactful. What better way to spend 60 minutes of your time watching an amazing, impactful documentary that could affect your life and that of your families forever. And it's only going to cost you $10. And that $10 is tax deductible because all proceeds from this special event, the special benefit event, is going to Caring for Others, which is a 501c3 foundation. Love to see you there. Love to shake your hands. It's really what we do is try to influence you to make a difference in your life and that of your families. This afternoon, 2 o'clock, immediately after Dr. Tom Roselle Live, I'll see you at the Bowtie Center in Reston. The Reston Town Center, Bowtie Cinema, 2 p.m. sharp. See you there. It's going to be a great event. Only $10. I mean, come on. And you get to write it off as well. 888-630-9625. That's where you reach me right now. And we're going to talk about several different things. I get a chance to pull the plug every once in a while, which I did over the last 8 days and just kind of did nothing and did some scuba diving and did some relaxing, got to talk to my wife a lot. And we, talk about what we do, work. We talk about you. We talk about the processes that come into, and you're saying there, why would you do that? Because you are my life. That's why I do what I do. There's so much out in the marketplace right now. And there's a lot of, confusion to certain situations, and it keeps coming back to, you can protect yourself against all kinds of things. Now, DHEA, okay, it's called Dehydroepiandrosterone sulfate, DHEAS. So what does that have to do with anything, right? Well, an interesting article in the American Heart Association Journal on stroke. And what they did is they did this huge study with a lot of different people, and they did it with nurses, and they did it with some other people. Anyway, 461 people took place in this thing. And what they came up with are people who are deficient in DHEA had a greater risk of stroke, particularly ladies in women. So what is DHEA? Where does it come from? Why is it important? And what happens? Well, DHEA is a hormone that is produced by the adrenal glands, your fight-flight glands, okay? Those little glands that don't have any ducts, if you will. They work like a sponge. They squeeze their contents into the bloodstream. They sit on top of the kidneys, and they put out a lot of different hormones. Cortisol is one. Blood pressure regulating hormone is another one. Blood sugar regulating is another one. Adrenaline, which we now call epinephrine and norepinephrine, and this thing called DHEA. Well, DHEA works in conjunction with cortisol to balance life for you and keep things working the way they're supposed to. And this American Heart Association publication was done by researchers from the Brigham Women's Hospital and Harvard School of Public Health. And so they got all the credentials, right? Everybody's there. So, okay, this is a great study. So they studied women who had no history of stroke upon the beginning of the study. This goes back to 1976. And they took their blood samples and, they analyzed them, and they analyzed them for DHEA levels. And this goes back 1988 and 1990. And what they did is they kind of matched it up for age, race, menopausal status, and so forth, and other factors, and they had, these control groups on top of that. And what they saw was this. Women whose DHEAS levels were the lowest. They were at the lower end, like the 25% of the lower levels. They had dramatically significant increased risk of having an ischemic problem of some sort, but particularly stroke. And that's significant in anybody's book. So what happens? Why does DHEA go down? So this is just a tidbit, something that you need to know about. It goes down under stress. When you're constantly in a stress mode and your DHEA goes down, other things don't work as well. So we know now it's affecting the cardiovascular system, inflammatory level goes up. But here's the other piece. Your other hormones, your estrogens, your progesterone particularly, is not going to be produced, and there's almost a direct linear correlation to it. You're going to see lower levels of progesterone as well. Now, why is that important? Well, because that also, and what they're not talking about in this particular study, will increase your risk of certain types of cancers. So DHEA is an adrenal hormone that gets depleted because of any kind of ongoing stress, whether it's pain or whether it's emotional stress or whether it's dietary stress, ultimately causing you those issues that we're talking about. So can you turn it around? Yeah, absolutely you have to turn it around, but you have to make sure that you begin to look at the stressors, as we've talked about, chronic pain patterns, biochemical imbalances, and emotional stress. You can't do one without the other. That's when our practice, when we look at a case, when we look at a patient coming in, regardless of what the symptom presentation is, meaning the complaint that they came in to see us for, we look at the why is that. Is it biochemical? Is it structural, neurological? Is it emotional? In most cases, if it's a chronic condition, it's all three of those pieces are involved. The documentary that you're going to hopefully come and see with us this afternoon will show that, because each one of these 6 patients who had failed under traditional allopathic care, we approach from all 3 sides of the triangle. We look at the neurological, energetic pathways, we look at the biochemical pathways, we looked at the emotional pathways, and we dealt with all of those at one time, so these patients had the greater advantage of turning things around. Another interesting article that we were looking at when it comes to cardiovascular or any kind of say metabolic disease has to do also with our old friend vitamin D. And what really, is the correlative here is that when you have stress or you don't have exposure or you don't have not exposure to sunlight and so forth, and not getting vitamin D at any level, your risk of different types of cardiovascular disease as well goes up. So men and women, by the way, with higher levels of vitamin D, meaning north of 50, and blood levels usually are between 30 and 100, have a decreased risk of cardiovascular problems compared to other people. And when you look at these levels of vitamin D and you correlate them across the board and see what their blood sugar levels are, what the inflammatory markers of fibrinogen and homocysteine and your different types of high density lipotropins, those are LDLs, and we look at the correlation. The lower the level of vitamin D, the higher the rest of that garbage is, and increases your risk of all kinds of different situations. So here's what the deal is. We look at you as a person. We look at you as a why is that? And why is that often is nothing more than your own doing it to yourself. You don't eat the way you're supposed to. You stress like crazy, and you walk around with pain, and you think that dealing with, Advil or Motrin or Tylenol or those things will keep the pain away. And as long as you don't experience the pain at the threshold that has been there for a long time, that you're okay. Well, nothing is further from the truth, because when you dampen the symptom, you do nothing to take care of the problem. And that's the thing that I want all of you to think about today. We're going to talk about a little bit about how you can team up with people like us or, with a coach to help yourself and to make huge differences in your lifestyle. We're going to talk about the stresses. We're going to talk about what they really do. We're not going to get through all of them, obviously, if I want to do them in detail, but I'm going to try to give you enough information that you can help yourself and make a huge difference. And, there was an interesting presentation that I went to, I don't know, it was about a month or two ago. I can't remember now, but because time goes very quickly. And I had a little problem with it initially, and it was basically about diabetes and the risk linked to red meat consumption. And, a lot of people think it's just cardiovascular in nature when you eat too much red meat. Well, what they said is that red meat consumption has been consistently associated with increased risk of type 2 diabetes. Well, that was interesting because it got my attention. I'm not a heavy red meat eater. I eat a little lamb once in a while, and it's occasional. But a study published in the Journal of the American Medical Association was the springboard off of this, and it's really set up quite a row between a lot of people. And they did about a study of 26,000 plus people, and then a follow-up study later on with about 48,000 people. And they said diet was assessed by the validation of certain types of foods, and they did it over a period of 4 years. And what they find is that people who ate red meat all the time, and it was an increased consumption of red meat, had a greater risk towards diabetes. I'm not all in on this. I'm not sure what it is because I think there's other factors that they didn't take into consideration, and those things are lifestyle and physical activity and alcohol intake and so forth, and you have to look at all of those things to make a difference. We got to take a break. Don't go away, and we're going to get to your phone calls today, but give me a call at 888-630-9625. That's 888-630-9625. This is Dr. Tom Roselle.
Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series video on demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education. Join Dr. Tom Roselle for a movie viewing of Ageless Health, the special. Ageless Health is a hard-hitting documentary based on the modernization of holistic health, natural care, and integrative medicine. You won't want to miss this Emmy Award-nominated documentary film. Proceeds benefit Caring for Others, Ltd. Ageless Health, the special, showing at the AFI Silver Theater in Silver Spring on Sunday, May 4th at 2:30 p.m. For tickets and information, visit agelesshealthmovie.com.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in studio. 888-630-9625. 888-630-9625. Love to talk to you on any subject that you have in mind. You know, this last week, 8.5 days, I guess I was away. Anyway, for me, one of the fastest ways of decreasing stress is to be about 90 feet underwater. You know, with the fish and playing around and just kind of hanging out and, you know, doing that on a day-to-day basis. I've always been able to chill quickly in the ocean with, you know, my playmates, the fish of the sea, faster than any place else. It's a great experience. But when I was down there, I was realizing that, you know, being away from the tension and the aggravation of the day-to-day, it takes me usually 72 hours to really calm down and enjoy where I'm at and then kind of pull the plug, although I never pull the plug. The effect of that, coming back, I'm relaxed, I look at my face, it's not tight, you know, my emotional set is a whole lot calmer. The trick is to find ways of doing that when we're not having to, or when we're in the day-to-day of the slings and arrows. You know, there's multiple levels of stress, and how we deal with it is more important. There was a statement by a guy by the name of C.W. Holmes. It said, the greatest thing in the world is not so much where we are, but in what direction we're moving. So are we moving more into stress patterns? Are we moving further away from them? Are we uptight and are we worried constantly? Or are we looking to calm the waters and go into a more relaxed state? You know, do we meditate? Do we pray? Do we relax? Do we do it with a fervor of just tranquility, or are we do it from a place of stress and worry? You know, you can do both things and get different outcomes. So what you have to do is chill, relax, find your sea, find your fish, find your ability to calm down, and you'll find that so many different things will change. Let's go to the phones just for a second. Laura, thank you for calling. How can I help you? Hi, Laura. Laura. Oh, Laura's not there. Sorry, Laura. Yeah, give me a call back. 888-630-9625. Love to take any of your calls today on any subject whatsoever. I'd love to talk to you. This is kind of getting back into the swing of things, but you've had some exciting people talk to you last week. You had Dr. Pina and Dr. Browning. By the way, Dr. Browning is going to be with me this afternoon at the Bowtie Center in Reston. And so come on over and say hey, say hello to all of us. How do you maximize wellness? How do you step up to the plate, so to speak? So you got to minimize the stresses that we've talked about. We have to minimize the process of emotional stress. We have to minimize the process of biochemical irritation, things that you eat you shouldn't, things that you need more of that you don't get enough of. And, so my mantra, avoiding sugar, sodas, coffee, teas, fast food, fried foods, alcohol, gluten, additives, preservatives, junk, generally the things that you shouldn't be putting in your body. Taking away the emotional stress and strains, therapies to get your body to function at a higher level, make sure that the nervous system is working, make sure that you're communicating neurologically the way the energetics are balanced properly, making sure that your muscles are strong and able, your lymphatic system is moving the way it's supposed to, and then develop a lifestyle, not just something that you do because you have to, but something that you do because you're trying to create something different, something new, something viable, something more dynamic, powerful in your life. Why would you settle for mediocrity when you don't have to, when you were given this amazing machine that can change anything? But sometimes we're unwilling. We worry constantly about things that we don't have any control over. The things that you do have control over is simply the capacity to change anything, to move forward, to make it different. So we're going to look at the environmental stressors. We're going to talk about, how the body begins to adapt to its environmental insults. We're going to talk a little bit about the stress and strains of structural patterns as we go forward today. And I want to take your questions at 888-630-9625. Listen, come and talk to me this afternoon. I'm going to be at the Bowtie Center, as I said, at 2 o'clock in the afternoon. Love to meet you. This is a $10 donation to Caring for Others, and you get to see 6 amazing stories of people who were left at I don't know what we're going to do anymore type of thing by the medical profession, the traditional allopathic approach, and were turned around completely without drugs, without surgery, and continue to do well today years later after the fact. Don't go away. We've got to take a break. We'll be right back after these messages.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You listen to Dr. Tom Roselle live in studio, 888-630-9625. That's 888-630-9625. Want to talk to us or get a message to us off the air, all you have to do is go to rosellecare.com. That's ROSELLECARE.com, and send us a note. One of us will get back to you. If you'd like to talk to somebody, one of my staff members, just face-to-face, you can do that as well. Call the office at 703-698-7117. And by the way, stuff that we're talking about today, Health is a Do-It-Yourself program. By the way, it is the title of my book, right? So you need to have a copy of that. Go to that website, rosellecare.com, and pick it up. Or go to Amazon and pick it up there, or download the audio. You can do any of those things. You should have a copy. It's your guide. It's your ability to reference all the things that we're talking about here. Talking about stress and how the body breaks down. But before we do that, I want to get back. Laura's back on the chart, and I want to go to her first. Laura, thank you for calling.
Thank you, Dr. Tom. I'm glad you took my call. I have 2 things to talk to you about. First of all, you're talking about lack of sleep, and I know how important sleep is, but the problem is I go to bed every night the same time, and my body is programmed this way, but unfortunately we have a neighbor who has a real bad big dog that barks at 3 a.m. in the morning, and I had reported this to the homeowners association. They sent letters to these people, and they're still doing it. I wake up startled, my heart starts beating fast, and I never am able to go back to sleep.
Have you tried earplugs? Seriously, I'm not kidding you. Have you tried earplugs?
I have earplugs. I do put earplugs, too.
Okay, there's acoustic plugs that you can get that are designed for people who are working around heavy equipment and high screaming sounds and so forth. You'd have to go online to get them, or go to an audiologist. They can help you with that. They'll virtually block everything out, and you won't hear much of anything.
Good. Okay, I'll look for that.
Yeah.
The other question is, what do you do about, how do you test for colonoscopy? I don't like the other stuff that they do in the, traditional.
Okay, I'm gonna give you my opinion, Laura, on colonoscopies, and a lot of the traditional science out there now is being refuted about having it done on a regular basis. But here's the deal. In our world, there's only two types of, if you're going to do a colonoscopy, there's the traditional kind where you go to the doctor's office, they give you a sedative, and they stick this long hose rectally, and they go through your entire bowel, and they look around, and they take biopsies and so forth. The other way is through radiation, which basically is doing a CAT scan, and CAT scan has a huge exposure of radiation. Now, both of them have their side effects. The one that they do manually, you have to worry about perforations and irritation and bleeding and so forth, and causing disruption of the integrity of the bowel. The other one is the accumulation of radiation.
Yeah.
Now, you have to do these things with some science and some knowledge and some intelligence behind it. So what do I mean by that? If you've never had any problems with your intestinal system, if your bowel movements are regular and daily, there's no changes in the bowel movements, you haven't seen any blood, you don't have a family history of any kind of bowel disease, and people who have lived long in your life, if I was that person, then I probably wouldn't have it done.
Yeah, I didn't do it. The doctors keep telling me, and I said,
of course.
No.
Well, that's what they do. You know, that's their job. And from their point of view, they want to do this as a preventive measure to make sure that they rule anything out.
Right.
If you've had one in the past and there's been nothing,
Never.
Then
I never had any.
How old are you, Laura?
I am 60 almost.
And you've not had any problems with your intestine?
No, I take probiotics, and I never take medication.
Well, whether you take probiotics or not, I mean, the chances are, as long as your diet is excellent, you know, you're eating and your bowels are working the way they're supposed to, at that point it becomes a personal decision as far as what you want to do. Your risk, if you go and you look at the literature today, as far as the need to have this procedure done, much of the literature is saying that unless there is a history of problems, there's really no good reason to have the colonoscopy done.
Yeah.
And you can go to many websites. So
the good thing, Dr. Roselle, is that I read a lot about that stuff, and I am against medications. I don't take medications. I just go for physical every year. That's all.
Laura, and if you
I eat healthy, and I eat.
Laura, keep doing those things, and you're going to stay much healthier than what you've been in the past. And be very careful. Make your own decision when it comes to that. Mary, thank you for calling. How can I help you?
Oh, hi. Good afternoon, Doctor. I wanted to ask about healthy sweeteners in this regard. I understand you've mentioned in the past about sweeteners affecting the brain the same and so forth, even if they're artificial. I'm concerned about which is the lesser of the evils among agave, stevia, or honey, for instance.
Honey. Without even hesitation. The reason for it's a single chain sugar. You don't use as much of it, and it doesn't take as much energetic to break the bond so your body can use it. Also, if you're using a organic raw honey, it has other types of enzymes and minerals that are associated with it. And so it's not stealing from the body. It's not depleting your body of B complex and some of the minerals and chromium and so forth that other sweeteners, regardless, are going to do that. As soon as your mouth tastes sweet, regardless of where it's coming from, it starts triggering a neurological reaction. It causes the pancreas to work. It causes the adrenal system to work. The receptor sites start keying up. They need certain types of mineralization. They need certain types of vitamins, and all of that goes into action. So we've seen patients over the years, for example, they come in and they're diabetic or they're pre-diabetic, and they can't seem to get off their medications, whether it's metformin or injectables. And we say, look, you got to not only change your diet, but you have to stop anything that tastes sweet in your body, period, end of story. Once they do that, all of a sudden their blood sugar stabilizes, they begin to lose weight, their inflammatory levels go down, and things begin to change. So stevia and agave, if you want to go through, a list of the best and the worst sweeteners, it becomes at some point a matter of who's doing the research. I mean, aspartame is the number one. Stay away from. I would not use agave. I would not use sucralose. I would not use of the ones that you mentioned. Stevia is probably the one that you could use somewhat, but still raw honey used in very, very low levels, in my opinion, is the way to go, and staying away from everything else.
Is there any particular kind of honey?
For me, the honey that we have in the house is usually Tupelo, and it's hard to get. But you can get it online. If you go online, you can pick that up. But again, the guideline is limit any sweeteners or anything that converts into sugar in your body. When you talk about the Mediterranean diet, my family is, as you've heard me, if you've listened to the program, I'm first generation Sicilian. And so when I go back to my father's village, in the mountains of Sicily, the way they ate is not that, when you think of Italians, you think of pizza and pasta and so forth. That's not how they ate. They ate vegetables, tons of different types of vegetables. The grains that they ate were wild rice, but very, very small amounts of it, and occasionally. The grain that they did have was the very, very yellow, deep wheats, and they only had that on occasion. But their meats that they ate, small pieces, 2, 3, 4 ounces of lamb, 2, 3, 4 ounces of chicken, fish, fresh fish, a lot of pure olive oil and so forth, fresh fruits, but limited amounts, nuts. That's a true Mediterranean diet. So, and if you use those things and you keep the sweeteners to fruits and a little bit of raw honey on occasion, not every meal, not 3-4 times a day, maybe once a day, and if you eat a little bit of fruit, you want to have a little bit of protein with it, have a nut with it, that sort of thing, you'll find that it'll work much better. Your blood sugars will stay much more stable. But anyway, that's my opinion, and you can kind of compare it out to what the literature's out there, but I think that you're going to find that it's consistent.
Can I ask just one short thing? Which would have the lowest glycemic index, stevia or honey?
That's going to give you a toss-up, but stevia is supposed to be the safest of all the sweeteners out there, according to different authors and so forth. And you can go back and check. Stevia is extracted from a plant called the stevia plant, and it has many ways of you can get it in concentrate, you can get it in powders and so forth. It has. It has no calories, but the thing is, it's still an extract. And I am always going to err to something that God put on this earth in limited amounts, because it has tremendous amount of side supportive nutrients with it that your body needs. It's like taking a drug from a plant where the plant would work, but extracting what the chemists think is the active component. What they've now lost is everything else that's associated with it that helps the body use it better. Does that make sense to you?
Yeah, thank you I appreciate that. Thank you very much.
You're welcome, Mary. Thanks for calling. 888-630-9625. Love to talk to you on any subject that you have in mind. By the way, that's another reason that you should join me this afternoon at the Bowtie Center, because several of these people that are in this presentation, in this Emmy Award-nominated documentary, had blood sugar handling problems, and we dealt with them straight up. And we dealt with them by decreasing the inflammatory responses in the body, decreasing the receptor site liability, the ability that it craved these things, it needed these things. But just remember, anything, again, going back to the same old, anything that tastes sweet triggers that reaction in the body. And if you're a sweetaholic and you're substituting fruit for sugar, your doctor says you can't do sweets, you got to stay away from anything that's sweet, but you go out and you start, you're eating 3 and 4 servings of fruit a day, you're drinking a glass of juice in the morning, you're crashing your system. You're just beating yourself up. It wasn't meant to do that. Diana, how can I help you? Thank you for calling.
Yes, I tuned in at the end of your last caller. I had a colonoscopy about 12 years ago, and everything was okay then. But since then, I've developed ulcerative colitis, and the gastroenterologist wanted to do a colonoscopy, but at the same time, he told me I could suffer a rupture. So I'm very frightened to have it done.
As you should be.
Virtual. Yes, thank you. Keep it something I have.
Yeah, as you should be, Diana. Listen, what I would suggest to you, if in fact that you have to have it done, that's one case, and God forgive me for even saying this, that I would do the virtual. I would not let anybody go in and do a traditional colonoscopy with you, because the risk with ulcerative colitis is way too high. And you really need to get to somebody, you need to get to somebody who does the kind of work that we do, to calm that thing down, because traditional medical approach, the azolfidines and the steroids and so forth that they use to treat ulcerative colitis don't work. They just, what they do is they cause a further degradation of the tissue of the bowel in a different way, and then ultimately your risk, obviously, with an ulcerative colitis, if they don't get it under control, is getting a permanent exit point to your body. And unfortunately, that happens way too often when, in our experience, much can be done. You don't want a stoma. You don't want to have to deal with that. But your dietary changes, acupuncture, low-energy light laser, balancing the nervous system, in our experience, has huge... Matter of fact, I'm going to tell you a story. When I was an intern, my first patient that I had control over as I was getting ready to leave the school was a young guy who was in his early 30s who had very severe ulcerative colitis, was having bowel movements 30 to 40 times a day, all blood and mucus. And, he came into the clinic in Chicago, and we started treating this guy. But how we treated him, and in those days, I didn't know a fraction of what I know today, but we dramatically changed his diet. We put him on vegetable juices. We put his bowel at rest. We used acupuncture. We did lower spine manipulation to increase the neurological balance to that area. And when I left, his name was John, by the way. I won't give you his last name. And when I left about 45 days later and graduated, he had gone not only into remission, but his bowel movements were down to about 6 times a day. He had some mucus. The blood was gone. He was starting to put weight on, because this boy, who was 6 foot tall, weighed about 136 pounds. So you can imagine how skinny he was. And he was able to turn himself around. So all I'm saying to you is that much can be done, but not the way that they want to go after it. Diana,
that's why he told me not to have the virtual, because of the radiology.
Yeah, the radiation is significant. But the risk, in my opinion, is much higher because of the other. I wouldn't do that. Diana, thank you for calling. I appreciate it. We're coming up to a break. We have to pay attention to those who are supporting Dr. Tom Roselle live. And don't forget, this afternoon, Bowtie Center, 2 o'clock, as soon as we're done here. Be right back. This is Dr. Tom Roselle. After 35 years of practice and almost 750,000 patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
If you're looking for the best in natural health, wellness, and green living products, shop the Roselle web store on Amazon.com. You'll find a variety of products and resources that are designed to help achieve an ultimate state of health and wellness. Shop the Roselle web store on Amazon.com today. Visit drtomroselle.com and click on Roselle web store. That's drtomroselle.com and click on Roselle web store.
Join Dr. Tom Roselle for a movie viewing of Ageless Health, the special. Ageless Health is a hard-hitting documentary based on the modernization of holistic health, natural care, and integrative medicine. You won't want to miss this Emmy Award-nominated documentary film. Proceeds benefit Caring for Others, Ltd. Ageless Health, the special, showing at the AFI Silver Theater in Silver Spring on Sunday, May 4th at 2:30 p.m. For tickets and information, visit agelesshealthmovie.com.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. Join me in about 1 hour from now at the Bowtie Center in Reston. We're going to be looking at a very, very special presentation of the Ageless Health PBS TV special. The twice nominated Emmy Award documentary featuring 6 patients who had failed under traditional care with very, very serious conditions of MS, ADD, ADHD, allergic anaphylaxis, seizure patterns, pain patterns, and so forth. It's a $10 donation to Caring for Others, tax deductible. Join me. I'm going to be there, and I'm going to introduce the film, and I'm going to answer your questions afterwards. So looking forward to, as soon as I'm done with the program, I'm out of here. I'm there. Please join me. Mike, how can I help you?
Hi, doctor. I was diagnosed with posterior tibial tendonitis bilateral, and about a year and a half ago, been taking physical therapy, ultrasound, TENS. I'm not getting any better, and since then I've developed tendonitis in both elbows.
Okay.
I guess I'm asking, is there something...
What's the fix?
Yeah, what's the fix, and what's wrong inside of me that I've developed this, and we can't seem to get through it.
Okay, let me ask you a couple quick questions because we're coming up to the end of the program. Mike, how heavy are you? How big are you? A guy are you?
I'm 6 foot, about 230.
Okay, so if you're about 230, depending on the composition of your body weight and so forth, it could very simply be that you're getting a lot of compression on the neurological network of the body. Have you had any injuries, accidents, blows, traumas over the last 5 to 6 to 7 years?
Well, I was diagnosed with AVN of the hips, and I'm going to end up having to have hip replacements, but
okay.
They're not connecting that with the issue in the ankle.
Well, I am. Okay, so anytime you get degenerative disease to the point where the joint is destroyed, regardless of whether it's in the spine or in the hips or the shoulders, you're getting a high inflammatory level and high acidic levels in your body. So small trauma, misalignments of the spine, rapidly degenerate because of that inflammation, i.e. acid, and causes your body to break down. So the fix in your particular situation, can there be a fix? Yes. It has to be approached structurally. It has to be approached from a biochemical point of view, and we see these types of things often. Mike, send me a note. Let's talk about it a little bit more because you can be helped. We're coming up to the end of the program. Meet me at the Rest and Bowtie Center. I'll see you in about an hour. Bye.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.